A disclaimer. In the following conversation, Dr. Shah's expressed opinions are solely his own and not those of the state government or the Audie Murphy Veterans Hospital.
In my training, I used to see 30 to 40 patients every day. But now, doctors can't even see 15 patients. They have made the job of a doctor so difficult that they are working at their half a capacity.
Hello, everyone, and welcome back to Ripples Physician Wellbeing. It's our podcast from the Joe R. and Teresa Lozano Long School of Medicine at UT Health San Antonio. I am your co-host, Dr. Adriana Diurich, and I am joined by Dr. Veena Prasad, our other co-host.
Wonderful. It's exciting to be here for the season 4 Life Beyond Medicine, because there's so much out there other than medicine. So we are trying to combine creativity like music,
yes, dance, writing,
pottery, advocacy, which will help our physicians to be better in what they do and take care of themselves.
We are very excited today to be talking to Dr. Jayesh Shah, who's a doctor of internal medicine and also our current Texas Medical Association president. So congratulations. Dr. Shah has made his home here in San Antonio, where he has many roles, but he's currently the hospital chief medical officer of patient line care at Northwest VA Clinic. And he's also a staff wound care physician at the Audie Murphy VA Hospital here in San Antonio. And also, if that's not enough, an international expert on wound care and the hyperbaric therapy. Welcome, Dr. Shah.
Thank you so much. And it's an honor to join your podcast. And I thank you both for doing all the work that you do for UT Health, supporting physicians, residents, fellows, and medical students.
Thank you.
Very excited to have you.
Thank you, Veena.
Jayesh, you wear so many hats, and I am so grateful for the work that you do for the Texas physicians and residents and students. I know you also teach classes to students, and especially the work you have been doing in terms of mitigating burnout. And the biggest thing that we are so excited to talk about is about advocacy, what role you're playing in terms of playing advocacy in Texas Medical Association. Tell us about what really got you into advocacy role. And I know you've been doing a great job with that, not just here, even in earlier other organizations.
Thank you, Veena. That's a great question. You know, I began my private practice in 96, 97, just after my residency. You know, I was on J1 visa, and then I went to Uvalde, Texas. That's where I started my practice in internal medicine. And I also started my wound care and hyperbaric medicine center in Uvalde first, and it's still running today. And at that time, you know, when I was in private practice, I realized, that, just seeing patients was not enough, because my patients were having trouble with co-payments. They were having trouble with insurance authorizations. They were getting delayed care. And I realized that it's not enough just seeing them one-to-one in the exam room. If I wanted to make a difference, I needed to advocate for it. I needed to make my voice heard. And that's how it started, because, our struggles continue to increase as our private practice, as we continued my private practice, I moved to San Antonio, and, the hassles continue to increase. We had electronic medical records, which caused trouble. They came in between physicians and patients. So it was not just insurance hassles, it was electronic medical records, and then certain laws that came in between patients and physicians. And it seemed like we were doing more work as a data entry clerk than as a physician. And that's how it started. And you realize that, like me, most physicians don't get burned out just by seeing patients. They get burned out because of the things that come in between.
Yes.
The patients and physicians.
I'm clearly, that's so important. I'm just imagining all of the administrative burden that I have as a physician. I'm wondering, I'm thinking back to when I was in medical school and then certainly in my pediatric residency, there was zero training about advocacy at all. And part of me wonders if, especially now, physicians should have some sort of training for advocacy in the curriculum, either in medical school or in residency.
Oh, absolutely. I think it's so important for medical students and residents to understand the basics of advocacy, because it is not complicated. Whenever you're seeing patient, you could do one-to-one advice to a patient about what's good, because there's so much misinformation out there.
Yes, true.
So it's not that people think advocacy means you have to go to Austin or you have to go to Washington, D.C. to do that. Even in your exam room, when you're talking to your patients, when you're talking to your colleagues, you can advocate. You can talk about what's correct and what's right. So advocacy is not complicated. It's something what you will do, something what you believe is right for your patients. And that starts in the exam room.
Yeah, even hearing that, I would say if somebody said, what do you mean by advocacy? I would instantly have thought going to Austin, talking to elected representatives, going to Washington, D.C., writing letters. And so when you say you can reduce it even to the level of the exam room, that's really
at the grassroots level, you could do that. In fact, it's interesting for our PhD program, advocacy is one of the courses that we take.
Oh, nice.
Yes.
And then you won't believe, but in 2003, when we passed that bill about medical malpractice, about tort reform, we involved our patients. And that's the only way we were able to win that battle. So it's so important that every day a physician can make a difference in their exam room by advocating.
Yes.
And talking about what's right for the healthcare.
That's great.
Yes. So basically, you're empowering patients by helping them advocate.
Absolutely.
So on that note, can you tell us a typical advocacy project or campaign? You have done so many, but something that you remember and that is close to your heart.
Yeah, early on in my advocacy journey, when I was in private practice and I see my wound care patients, they were getting delay in their care because of prior authorization requirement. Yes. And sometimes, our diabetic wound patients, if they have to wait for some treatment, that wound can get infected, they can get into hospital, they can get into emergency room, and they may end up losing their leg. And sometimes that can, in diabetic patients, if you lose a leg, you basically lose a life, There is a lot of data about mortality with amputation. So it's the example I had was, I first wrote a resolution on prior authorization. This is a long time ago. And that became a gold card bill in Texas. And that gold card bill is become so popular that every state is trying to kind of using that language. And even in federal legislation on prior authorization, that gold card bill language is there.
Wow.
So it's a pretty successful story of a single physician who feels that there is some trouble in the practice, and he can channel that energy to advocate and make a difference for so many patients.
Yeah. What an amazing legacy
yes,
that
I
is.
know. That itself is just thinking about it is so inspiring.
So let's look. So that's an amazing, I had no idea about, because tort reform is such a huge deal for Texas. Talk to us a little bit about if we look in the future and some of the challenges that physicians are facing now. What are some things that you think advocacy will help with that we can do now for some of those challenges that you're seeing?
Right now, there are a lot of challenges. We just went through pretty difficult legislative session.
Yes.
It just ended. And as you see, there are so many issues that if you don't take care of it, if you don't advocate, then your patients will have trouble. So I can give you some examples of some great wins that we had in the legislative session. And you will realize that our scope is so big, right? There are we defeated multiple scope of practice bills. Like everyone wants to be a doctor without going to medical school. So there are scope of practice bills from multiple, practitioners who are not physicians, which
Yes.
are chiropractors, which could be dentists, which could be optometrists, audiologists. They all want to become doctor without going to medical
Right.
school. And there were a lot of bills that we had to fight and kill in this legislative session. There were bill on non-compete reform that most medical students and residents don't know about when they go and get their first job. Then they get that contract and then they read that non-compete,
Yes, yes.
and we passed that. This legislation, which was a balance between what a physician, how we can protect an employed physician and also a self-employed physicians
Yes.
when they are hiring. So it was a great balance that we were able to pass that. So that was great. Then we had a lot of public health wins. Like we had, dangerous e-cigarette bills that we had to work on. We banned that on advertising e-cigarettes. Funding dementia research, right? UT Health is big on dementia
Yes.
research. So we had like $3 million for that, and improving school nutrition. So that was great win that we had. And then a lot of managed care laws that we passed, like prior authorization, that gold card bill that we talked about, we kind of improved it because we passed that gold carding bill a few years ago, but it was still not getting into effect. Like most physicians were still kind of not getting benefit out of it. So we cleaned that bill, and hopefully we are thinking that the physician will start getting benefit out of that. Credentialing bills also restricted AI-based care denials. So that was another great win. And then a lot of times we are killing bad bills. There were
Yes.
some really bad insurance bills that could have caused so much problem with patient access. So we killed that. And, there were some bills about mRNA vaccines that we will not have been able to give, and that we had to kill. And then there were a bill that will have sued a doctor if they were giving immunization. So we killed that bill.
Wow.
So if you really look at it, it's a pretty broad depth,
Yes.
and it goes from public health aspect to the physician practice. And so there's a lot of work that we have to do. And it's amazing work that gets done behind the scene and by the doctors who show up and then they lobby for it. And then some doctors cannot come there, but they just send an email to
Yes.
their legislatures.
Yes.
So it's a lot of, we had a great successful session.
It sounds like an amazing session, actually.
Yes.
Wonderful, great. I myself am a big advocate for advocacy, but we are always talking to physicians or residents. Advocate for yourself or any of those. They say, no, advocacy is not my forte. I just don't have the time. And I know you get things done. How do you overcome that pushback and still encourage people to advocate?
Yeah, I think it becomes like, as a physicians, we are kind of more patient-centered. Most of us wants to do good for the patient one-to-one while we are seeing them, and it makes us happy when they get better, right? That's why we became a
Yes.
doctor. That's the easiest reason why, if you interview any medical student, any resident, that's the reason they will give. That's why they became a doctor. But they don't realize, till they get into practice or a real world, that there are so many hassles that come in between for them to do
Yes.
the good job. And once they understand that, then they understand the importance of advocacy. And I think the important thing, as I said, is to make it simple for them. The term advocacy kind of makes it feel like they have to spend a lot of time
Yes.
to do it. And as I
yeah.
said before, it could be as simple as sending an email to your legislature, which we pre-formed for them. And they can just write a little story about what they had experienced. And it takes less than 30 seconds to send a letter, which is very effective, to their legislator. So, as I said, it's not complicated. It is like patient care, but at a community level.
It's interesting you say that when you talked about the stories, because one of my committee roles in CFAS, which is the Council for Faculty and Academics Societies, which is part of the AAMC. The AAMC really was asking us and physicians to provide stories of how some of the things that have happened or some of the new laws were affecting them and their patients. And they said, what we really need to know is we wanted stories about how your research has been affected or how your loss of those grants potentially could affect patients. So we can bring the discussion down to the individual patient level and not make it something much larger than that. So,
and I think that's so important, right? We make it simple for our patients to make them understand a complicated disease.
Yes.
And in advocacy, you're doing the same thing. You're basically making it very simple for your legislators, how that is affecting you. So when you tell them a real patient story to a legislator, or when you're writing to them and tell them, my patient got into trouble, like for me, if I give an example of my wound care patient, because of my delayed authorization, end up getting amputation, they connect to that story.
yes.
Because those are their constituents. They want to do best for their constituents. But they don't realize, because the healthcare is complex.
Yes.
And they hear multiple voices. So if they don't hear your voice, then it doesn't get implemented. They don't know that what is right thing to do for certain law. So your stories are very important. So I really feel that advocacy is extremely important, that every physician should be part of it.
Yes. So you're a clinical physician, but you're also now the TMA president, and I'm sure that job comes with a lot of time and hours of work. And so my question is, how do you find time to balance those two roles, and also add to the fact that you also are a husband and a father, and you have duties outside of medicine?
It takes a village to make anything happen. So I'm thankful and grateful to my colleagues who helps me with coverage. I'm thankful to my wife and my family who is willing to share me, and share my time, because you're busy. You're trying to do things during the time that I have to spend with them. And their understanding is very important. But at the same time, I think, everybody has that 24 hours. And it's how you dedicate your hours, how you make your schedule, and how you manage your time. That is important, I think. And that's where I have a God's blessing, that usually I get a good sleep. And no matter what's going on in the world, I get a good sleep. I wake up on time and I start my day early as 4 o'clock. Wow. And so I'm able to do my self-care. I'm able to do my exercise. I'm able to do yoga. I'm able to do meditation. And, my nights, I don't take phone calls, and dinner, we don't take phone calls.
Yes.
And keep the phones away. So I'm able to spend time with the family. And that's the only way you could do it, is it basically having good discipline and time management.
Yes, I understand that.
Yeah.
Yes, and having someone like Neha to help you.
Yeah, absolutely. That's a huge difference.
Yes, she's always there for everything.
Yeah, absolutely.
If you were to pick one kind of a legacy that you want to leave in terms of your advocacy work, we talked a little bit about one of those earlier, but is there another area that you'd like to focus on or provide a legacy for yourself in terms of your role at the TMA and also your advocacy?
After doing advocacy work for 25, 30 years, I feel like if we allow doctors to be just doctors, so my theme for this year is let doctors be doctors. I think if we keep that as a theme, we can really make a great healthcare reform. Because what it tells you is, if you allow doctor to function to their full capacity, take all these layers out, take the prior authorization out, take the delay of care out, all this EHR hassles
documentations,
out,
all
the
of
documentation out, the doctor is going to be more effective. Like in my training, I used to see 30 to 40 patients every day, and in my initial years of practice too. But now, doctors can't even see 15 patients. So they're talking about shortage of physicians, but they have made the job of a doctor so difficult that they are working at their half a capacity. So if you just change that, if you think about that, it's a very simple formula, and just let doctors be doctors, and you can have a great healthcare reform.
Completely agree. And in fact, one of the things we talk about is that physicians see the burden and workload of their peers and of those that are their faculty members and those in private practice. And so a lot of our graduating residents are already looking to have reduced hours or flexible time. And those decreased hours are actually just adding to the physician shortage. So I agree with you. If you made it a joy to be a physician rather than incredible amounts of work, I think people would do that less.
Yeah, and there was a recent study by AMA that if you lose one physician because of burnout, it's a millions of dollars cost to a system. So if we take care of our physicians, then the healthcare works, our institution works, and everything, our patients are happy too.
Yes.
Oh,
So
absolutely.
I think it's so important, and that's why I love your podcast. It ripples the effect of making sure that we take care of our own, take care of our physicians.
Yes.
Yes.
Thank you.
Even when residents come to us, we talk about their burnout. It's not about patient care. It's about all the other things, paperwork, notes.
Yes.
It is so much of that. So if you take that out, it makes perfect sense.
Yeah.
If you take that out, just doctors with patients, it's win-win for everybody.
Absolutely.
Yes. On that note, as we come to ask our guest, what is one actionable item or a thought that you can leave with us? If somebody is listening to this and say, oh, advocacy, what can I do? And something that physicians can take with them. They can use it or they can advocate for advocacy, any of those things that you can leave with us as a pebble.
Yeah, I think, first thing is advocate for yourself. I think that's the most important thing, is to take care of yourself.
Mm-hmm.
And I have learned in my journey as a TMA president, going all over the state and meeting all the physicians, I feel like burnout is pretty common
Yes.
in all discipline, and doesn't matter, even medical students, residents, and fellow, everybody's going through that phase of burnout. And it's so important for them to take care of themselves. And like in the airline industry, I just flew back from Chicago today, and like the airline air hostess says, put a mask on yourself
Yes.
first before you put on someone else.
Yes.
So I think advocacy is great, but you can only advocate for others if you can advocate for yourself.
Yes. Yeah.
Advocate for self-care,
Self-care.
actually.
Absolutely.
Yeah, we often say you can't drink from an empty cup and you can't give water to someone else from an empty cup.
So nicely said. Yeah.
Yes.
Yeah.
Thank you so much on this wonderful episode, and we hope to see you, and then we continue to look forward to more work that you're accomplishing for our physicians and residents for the state of Texas.
And I think for me, you've opened a lot of eyes to what advocacy can be, and it's more than just what many of us think it is, and driving up to Austin and talking to elected officials. So thank you.
Thank you so
you.
much, and thank you for having me on the show.
You bet.
Ripple's Physicians Wellbeing is made possible by the Joe R. and Teresa Lozano Long School of Medicine Office for Graduate Medical Education. To contact us or learn more about the Wellness Home, visit gmewellness.utesca.edu.
This podcast is inspired by the Dalai Lama's powerful quote: "Just as ripples spread out when a single pebble is dropped into water, the actions of individuals can have far-reaching effects." We provide physicians with pebbles, tangible and actionable practices that can help make positive impacts in their personal and professional lives.